So yesterday we talked about acute renal failure. Today the same topic will be continued as chronic renal failure. Okay. So this is very important, and nowadays renal failure is most common because of hypertension, diabetic. These are the primary causes, and secondary are using of toxic substance, toxicity, and third one is any other issues. So we'll discuss in detail what are the causes and how to diagnosis. Diagnosis is very simple, but here cause and treatment. Second part is treatment, very difficult and it will take time. Okay, and it will take money and it will leads to sometimes a death also. But some persons are living with chronic kidney failure with on dialysis, hemodialysis, okay, dialysis. So we'll discuss whatever important things related to chronic kidney failure. So again, chronic renal failures means chronic means from more than 15 days or 1 month or 3 months. More than 15 days, 1 month or 3 months. Okay, means the function of the kidney is not happening properly since past 15 days to 3 months. So we will give the term as chronic renal failure. Okay, so this is called chronic renal failure. So what is the causes? Causes are same like acute renal failure, but if it is long term, okay, then the chronic renal failure will happen. Okay, like we have nephritis, inflammation of nephrons, initially nephritis, then damage of nephritis, then the death of nephritis will happen. Okay, and necrosis, death of
Doctor, volume is very
nephrosis,
low.
doc, nephrosis. Okay, so next is necrosis. Now the another is decrease input of circulation, circulation to the kidneys, decrease circulation to the kidneys are the major cause, and opposite to the decrease it is increase in circulation. Okay, it leads to hypotension, it leads to hypertension. So both hypotension and hypertension both are dangerous. Okay, and you have, okay, I hope you are getting the sound properly. So decreased circulation means hypotension. Hypotension is leads to renal failure, and hypertension also leads to prolonged, not some sort, but prolonged hypertension leads to kidney failure also. Okay. And second, what are the other causes? Other causes is uh, some pathogens also we have, like toxins. Okay, some types of toxins or decrease water intake. Okay, decrease water intake. Decrease water intake also may leads to renal failure. Okay, and we have parathyroid hormone. This is also one of the cause in pathogenesis cause of chronic renal failure. So what are the clinical features? The reasons are very simple, but uh, had to be controlled. It is very important. Main cause nowadays is hypertension and diabetic mellitus. Hypertension and diabetic mellitus are the two major causes of chronic renal failure, which is because they are prolonged from many years. So I saw two patients of chronic renal failure who are young adults. Okay, they have the habit to eat food outside food, junk food, and they doesn't have sleep at night, decreased sleep, which leads to hypertension. Okay, prolonged hypertension. They doesn't know that they have hypertension. They doesn't have any symptoms, but suddenly they have chronic renal failure. Okay, so these are the cycle chain. Okay, if one organ is affected, so definitely the another organ which is not strong, not their immunity is not strong, their function is not strong, they are structurally very weak, so they definitely will attack by that organ. Okay, so this is very important. We have numerous clinical features. Okay, we have nervous system symptoms or clinical features like prolonged headache. Okay, always headache. Okay, weakness. Okay, and restlessness. Okay, these are the cause of insomnia. These are the clinical features in the respiratory system. Gastrointestinal tract. What we have? We have nausea. Yesterday we talked about that. Nausea, vomitings. These are the symptoms. Clinical feature. Respiratory system. Some patients have SOB, shortness of breath. Okay, and dry, sometimes dry cough. And we have another cardiovascular system. We have patient have hypertension. These are the features we can see that. And cutaneous symptoms like their skin is dry skin, very dry skin, and they have wax on the skin. You can see what are the symptoms of subcutaneous or cutaneous. Skin eruptions, you can see easily skin eruptions, and pale color skin due to the deficiency of hemoglobin. Okay, this is very important. Next, you have muscle or muscular symptoms or features like uh, they unable to bear the temperature, nor cold nor hot. They don't bear the either cold either hot. Okay, so this is very important. All the features and the clinical features of system wise nervous system, headache, weakness, restlessness, insomnia, GIT, nausea and vomiting, respiratory system, SOB, dry cough, cardiovascular system, hypertension, and cutaneous, you have dry skin, wax. Okay, skin eruptions, pale skin, and muscularly they have unbear. They doesn't like cold, very cold and very hot. Okay, so basically, initially, you cannot tell the same person have same symptoms. Initially, some patients develop decreased HB levels, means they have anemia initially. Then later on, these symptoms arises like nausea, vomiting, neuromuscular weakness, headache, or hypertension, okay, skin eruption, etc., etc. Okay, so in the patient will have the complaint that they don't have decrease input output of urine. In the urine, they see the protein will leak from the skin, okay, because the kidney cannot uh, functioning, so kidney are releasing protein. So you can see uh, in the urine albumin, okay, all this type of urine, okay. So this you can see that the patient having chronic kidney failure. So it is very important to understand all these things. Now come to the part of treatment. In the treatment plan in the allopathy, if the serum creatinine levels go beyond 7, they will advise dialysis. Okay, there are different types of dialysis. In this, we have hemodialysis. Mhm. In that whole blood will be enter into dialysis machine, and it will purify, and again the blood will enter into the body. So according to the condition, some patient needs thrice a weekly, some needs twice a weekly, some may needs daily. Okay, sometimes some patient needs daily. Okay, so it is purely depend upon the condition of the patient, how much amount of serum creatinine levels are there. Some patients will, after doing 2 to 3 sittings of dialysis, okay, or 1 to 3 months, their kidney will start doing normal function. Sometimes will have this will happen. Okay, this will happen. Most of the patients I saw that normally I saw 2 to 3 patients after doing dialysis because they are in acute stage. So mostly that's the reason. So their kidney function started normal and they have normal creatinine also. Okay. So this is in the allopathy. So what we can do as a electro homeopathy practitioner. Basically, we have functional remedy, okay, and we have structural remedy. In the functional remedy, we have S6. In the structural remedy, we have C6. So basically, these are the remedies which are designed to cure and treat the disease of kidneys or renal. Okay, so definitely use S6 and C6. Other than that, we have C17, and according to the symptoms, you will advise the patient. So basically, what we will give that first, we will go to uh, either S6 or S2 also. Because initially, what will happen if you work directly on the kidneys, it will take time because now initially you have to remove the excess toxic substance in the blood, and it is also reached to the body and other parts. Now you need to expel the all the toxic substance from the body. Okay, so we have to focus that also. And second thing that we also focus to remove, not only remove, to improve the function of the kidneys. So both you have to focus. So initially you can do X2 S6 or L1 and BE, because here S2 S6, because S kidney is not only an organ, it is a gland also. Okay, because we have uh, it will secrete renin, erythropoietin, etc., etc. Because of that reason also, it have work as gland. So at that time we can use S2. Okay. or alternately you can use S2 and S6. Second is we have to improve the structure. So best with C6 is when 1 and G or Y. Sorry, here Y already, here B is taken. So we are taking here Y. And another one is to remove the impurities. We have C17. Okay. Rapid dose, regular dose is given. And another one is S6, C6, C17 or S6, C17 plus Y. You have to give in D5. Another remedy which not only remove the toxic substance, which remove the toxic substance from the kidney. Okay, this particularly. And we have the another remedy S6, C6Y. Okay, and initially we will give this remedies, and depending on the function, depending on the condition, gradually we will improve or we will add another remedies. Okay, so this is very absorbable, very critical condition, and you need to treat the patient with guiding with any of your senior doctor. Okay, so you have to take the advice of the not only the electrohomeopathy practitioner. Along with that, you need to take the advice of allopathy doctor also. So suddenly his BP will arise. Suddenly his BP will low. Suddenly there is a increase in the glucose level. Suddenly the glucose level will drop out. Okay, sometimes patient have due to the increase in the fluid, the ascites will happen. The same pleural effusion will happen. Okay, so everything, anything will happen to the patient. So we need to focus and we need to take the consent of our electrohomeopathy doctors who have experience in this field. Okay, so which will give much more results. But initially, you will start with this treatment. The patient will have benefit definitely, but it is very longer duration treatment. Okay, you need to advise the patient. Definitely, if you use these remedies, gradually your kidney will improve. Okay, if it is he is young, then definitely there is a chance of reconstruction of kidneys. Okay, regeneration of nephrons. But he is old. But he is old. Second, he is old. Then what will happen? The symptoms which are arising due to the kidney failure, like insomnia, headache, vomiting sensation, loss of appetite, dry skin, okay, and other things, okay, which will gradually improve. Okay, so this is all about in chronic kidney renal failure or acute renal failure. So if any doubt, kindly ask. We will